The President will be speaking for the fourth time okuva ekirwadde kino kibalukawo oba kiba confirmed mu September 2020 abwetwogerera jinja abantu babiri bafudde ekirwadde kino ate nga okusinziira ku World Health Organization alipoota yayo gyeyafulumiza ega nti nearly 160 people abe bakakwatibwa ekirwadde kino mu ggwanga erya Uganda, and a huge, or rather a fair number of Ugandans nabo be bakafa ekirwadde kino. Bwe ntunulira alipoota eno eraga nti abantu basoba 20 be bakafa ekirwadde kya Ebola mu ggwanga erya Uganda. How is the country handling this situation? Tusubire ki olunaku olwaleero omukulembeze wa Uganda ng'agenda okwogera Kasanda Mubende bakyali ku muggalo. Are we taking the right direction as a country in curbing the spread of this virus? Well, okuddamu bino nebuuza ebirala mu studios negadduwako Council Simon Peter Kinobe munnamateeka ate ng'ava mu kibiina ekiri mu bukulembeze bw'eggwanga ekya National Resistance Movement. A very good morning, Council.
Morning to you. Nsanyuse nnyo kubeerako wano era omulundi omulala era ndowooza n'okusuubira nti bye tunaayogerako leero bijja kuba eby'omugaso eri eggwanga. Tulina ekirwadde ekituzinzeeko, ekirwadde ekyo kitta bubi naye ng'ate kisobola okujjanjabibwa ate nga kisobola okukubibwa eggo. Naye ebyo byonna okubaawo kisinziira ku bye tukola, enneeyisa gye tweyisaamu n'okugondera amateeka. Era nsuubira mu programu eno ebimu bye tugenda okwogerako. Ekintu ky'obulwadde simanyi lwaki bongeddeko ekibiina kyeneekubiramu, naye ebintu by'obulwadde tebiriimu kibiina. Kuba oba oli wa DP, oba owa UPC, oba owa FDC, oba owa NUP, oba owa NRM, obulwadde obukukwata bukuyisa kyekimu, tebusosola ti ono wa NRM katumuyise bulungiko. So abantu balina okumanya nti ekintu kino eky'obulwadde bwa Ebola tekiri political naye ffenna kitukwatako.
Council, government egamba the situation is under control. The rising numbers buli lukya owulirayo pya. In your view, is really the situation under control?
I think the situation is under control. Kuba tetunatuuka kiseera kya kweraliikirira nti abalwadde bangi. Bo mwebali abafudde ndowooza balinga 2. Kati ate okigeraageranya ne Ebola second phase eyo olaba nga tukyalina control ey'ekirwadde. So government ntuufu ogamba ekyali in control. Naye ate nga bw'egamba eri in control, buli muntu yandibadde yeesuna ku ttama n'agamba baganda bange ekintu kino kikiva mu nteeko.
But World Health Organization already upgrading the risk y'Ebola mu Uganda okuva ku high negenda ku very high. We've had amawanga agatuliraanye gongedde okuscreeninga. Atulabyeku eggwanga lya US nga lirabula bannansi baalyo abatravelinga wano n'abagenda eri.
Now, first, a pandemic like Ebola. Ebola has not yet reached the proportions of a pandemic, but it can easily become a pandemic. So I think everybody needs to take precaution, and that's what these other countries that neighbor us are doing. It doesn't mean that the situation has gone out of control, because government does not rely on general statements. Government relies on statistics, and these statistics are out there. How many districts are affected? For somebody to say it's the risk is very high. So the districts affected, I think, are very few. Out of the 145 districts, we have about 4.
We are now talking about
9
districts in Uganda.
So, but even of the 9, The ones critically affected are 3.
Now let's look at the figures.
There is Kakido.
Council, let's look at the figures here. Tugira ku Nyangabu, waliyo case emu, Jinja lero DEO, rather DHO,
one case,
Jinja tugambye kati ziri 2.
Okay.
Kusinzira ku DEO,
And
DHO.
one of them I think died yesterday.
Yes. Then Kagadi case emu, Kampala 17, Kasanda 46, Kyegegwa 4, Masaka emu, Mubende 63, Wakiso 3.
Kati now whatever statistics says.
This is according to World Health Organization.
That's World Health Organization. So you have 42 in Kasada.
Yes, 46.
Mubende has reduced 46. Mubende was the highest, Madudu, where it started, but now it has reduced because of curfew and discipline. Kasada has gone up, Kampala has 17. But look at the statistics. You can't say very high because one of the 9 districts, you have 1 person, 2 people. That should not be worrying, especially if their contacts are traceable, number 1. And number 2, the beauty with Ebola is that it's not an instant disease. You have to have symptoms. Either you're passing blood, stool, and it has to be contact. It's very contagious, but you have to show symptoms for you to pass it on. So when you look at 143 districts, 9 are affected, but even the 9 that are affected, they are not considerably affected. The victims are 2, 3, 1, 4, apart from Kasada and Kampala, which now should concern us. Because in Kampala, if you have 17 cases, and you can trace these people to more than 5,000 people, you need to be concerned. And I think the issue of discussion should be how do we prevent it from becoming a disease to a pandemic? Because the moment it goes to a pandemic, and that's where people in Kampala, people in Uganda should be concerned. Government will not hesitate. We shall lock down regardless of the economic stand of our economy. So
we shall get back to that, Council. President Museveni leero agenda kwogera for the 4th time since this outbreak was confirmed in the country. Omundi gwasooka yogera ngenda kuzomweza 28, just 8 days after September 20th. Then twalina abantu 5 abaali bakafa ekirwadde kya Ebola. Today we are talking more than 20 abakasakambinga ku kirwadde kino. This is roughly less than 2 months. Are we taking the right measures in curbing the spread of this virus?
Now, just to strengthen Ugandans who may be panicking and those in the diaspora who are concerned, this is not the first time. I don't know why we are acting like Ebola has hit Uganda for the first time. This is not the first time Ebola has hit Uganda. This is, I think, the 4th.
No, it's more than that.
It's more than 4 times.
Yes, I can hope that you are still.
Yes.
We have had several Ebola cases, and good enough I have the figures here. Wotunulira ekirwadde ky'Ebola enfunda oba ebbanga lituze tubeera nakyo. Mu 2021 twalina abalwadde ndowooza ennamba ekyasinze. Abantu abakwatibwa cases 425.
And that was in Gulu?
Yes.
Yes, where Dr. Lukuya died?
Yes. Then 2007-2008 twalina cases 131. Mu 2020 yali Sudan, eriwo kati Sudan Ebola virus. Then 2007-2008 twalina bundi bujjo Ebola virus. 2011 era twalina Sudan Ebola virus, muntu yali omu. 2012 twalina Sudan Ebola virus, bantu 11. 2012-2018 twalina Sudan Ebola virus, bantu 6. 2019 twalina Zaire Ebola virus, bantu 4. Kakati 2022, so far we are talking about More than 150.
So we have many victims, but we are talking about 7, 8 Ebola, attacks.
Since 2000.
Since 2000. And, with everything bad that comes, there is something good. And Uganda has proven to be one of the best, if not the best countries in the world in containing and fighting pandemics and highly infectious diseases. And our record comes from 2000 when Dr. Lukia died. It's unfortunate that he passed on, but were able to curtail the spread of Ebola. It could have been very bad. For those who are watching us that do not follow international incidents, you want to relate what happened in Uganda at that time during the Ebola pandemic to what happened in Sierra Leone. In Sierra Leone, actually, it came from, in fact, it came from a disease, an infectious disease, to a pandemic. And we had World Health Organization, which is rating us, and these other international agencies called upon Uganda and said, you have done very well in fighting pandemics. How can we do? Because they had failed to contain the disease in Syria. And we sent a team of doctors and experts. And because of, partly and mostly because of the work we did there, the pandemic was contained. So just to strengthen Ugandans, the Ministry of Health and government knows what they are doing in terms of fighting this disease. And so while we have an increase in cases, I don't think we have reached a level where we should be concerned that it is now revolting into a pandemic. But also
government knows what is doing. I hear you. Still, you're saying, which is true. But this is the first time we see government putting 2 districts on a lockdown. This has never happened before. Did we learn any lesson from the past cases?
I think it's not, first of all, I think it's not the first time government is putting...
because of Ebola, it's the first time.
During the one in Gulu, there was a curtailment. In fact, for you to cross Karuma was very, very difficult. There was a curtailment on movement to contain the spread. We've had a lockdown during COVID. It's not something new. And so, yes, we've also had a lockdown in Mubende.
Are we adopting a new...
But this is what I think.
Council, are we adopting a new measure tunafunanga ekirwadde threatening descending into a pandemic that we shall be locking our people?
Now we need to understand 2 things in reply, in answer to what you've asked. One, discipline. You know, Ebola now would have gone. It wouldn't be a problem. But you had people in Mubende who decided, and I think out of the lack of discipline, but also ignorance, I think we did not sensitize. And, yes, ignorance and stigmatization. Kuba Ebola we yajja abantu nga balikubaga ho mugenda kufa. Ali waliwo abaali balowooza dogo. To the extent nti baziika family, ekintu ekyali kya nnaku nnyo. Omusajja baamuziika naye nga musiraamu. Bagamba ate bamuziikidde mu bulombolombo bwaffe. Ekiro ne bamuziikula. Ne bamuziika era family eyo abaamuziikula omusanvu baakola ki? Baafa. Ojjukire yatoloka mu baali abalwadde be baali batutte mu ddwaliro. Yatoloka najja mu ssabo oba yagenda mu ssabo ewa Eruweero. Kati ate n'ava Eruweero mu ssabo najja ne bamukweka e Kampala. Kati zezo cases z'olaba because of indiscipline naye n'obutamanya ne stigmatization. Singa abantu baali bawuliriza we twafuna obulwadde buno mu Northern Uganda eggulu, community yali so alert. Tukoze tutya ate wali na ddagala nga tetumanyi nti lisobola n'okujjanjabibwa naye nga community eri so sensitive, eri so alert, so concerned, ngera bo beekolamu omulimu okulaba nti bano ababulina obulwadde batuuka mu ddwaliro bajjanjabibwa tebasaasanya nnyo mu community ababadde nabo nga beisolatinga. So gwe bw'ona olowooza nti gavumenti buli wamu ejja kujja ekusibe oleme kulwala, obulwadde buno tetujja bumalawo. Ffe tulina okwekolamu omulimu nga bannayuganda nga bannansi okulaba nti gavumenti weeba etaddewo obukwakkulizo nti tova mu Bende kujja Kampala tosaasanya kirwadde, beerayo ennaku 21 21 days, that's the gestation period for Ebola. Ziringa nnyingi naye si nnyingi nnyo ku bulamu. Woba olowooza nnyingi ku bulamu, linda ofa ojja kutegeera nti obulamu tebuliiko spare, tebuddizibwa. So it's an issue of discipline, stigmatization, and I think the lack of sensitization that has led this to where it is now.
Well, much as I agree with you, Council, nti kuludda lwaffe ng'abantu tulina okuba quite vigilant okwisobozesa ekirwadde kino buta spreading nnyo, but we can still not, take away government from taking a lead role. As we speak, abaana b'amasomero bagenda kusindikibwa ewaka prematurely, but the rest of the country remains open. How do you expect okulwanyisa ekirwadde ng'olise ebivulu? Nalabye Eddie Kenzo wano mu Kampala yabadde n'abantu abasobye emitwalo 3. Nalabye abawagizi ba General Muhoozi abayita Muhoozi Army ku weekend bakuŋŋaanidde wano e Kamwokya, more than 10,000 people. I mean, that's why I'm basing my question. Are we taking the right precautions, the right measures okulemesa ekirwadde okusaasaana?
Ekisooka oyina abantu, and let me explain this in medical terms. Kino be walwala babuuza abadde naani, nga bagamba abadde ne kkungu, abadde ne gundi, abadde ne gundi. Abo babadde nabo babadde ne baani. Symptoms yatandika ziraga ddi, weyaziraga yali naani, kye tuyita traceability. Kati for as long as you can trace the contacts, never contacts one ne babeera disciplined enough, there is no cause for alarm. Naye weotandika okubuuza kino oba symptoms yaziraze ddi ku Tuesday, yabadde naani simanyi, ye gwe yabadde naye yabadde naani tetumanyi. The moment you cannot trace, then you have a problem. That's when now you start doing drastic measures. Let's lock down to prevent people from moving. Buli omu afiire gyali oba afune obujjanjabi gyali aleme kukola ki kusaasaanya. Wano we tutuuse ku bulwadde buno obw'Ebola, buli abulina ne gwabaddeko naye n'abo gwe babaddeko nabo abo ababadde naye bamanyiddwa. Era system eri so interesting nti bakube bagamba gwe gundi wabadde gundi ne gundi ayina Ebola, tusaba osigale ki awaka. Era tutegeeze n'abalala naddala abo ababadde naye ku budde bwabadde atandise okweexpressinga symptoms, because Ebola tasiigibwa nsobola okuba naye wano wemba sinalaga symptoms ez'okusesema omusaayi omusujja ebyo sisobola kuwa bulwadde obwo ne bwenkwata naye kasitantandika symptoms nsobola obukuwa. So tulina okutracinga okulaba ani abadde naye ku kiseera ekyo. Ate kati gavumenti weetuuse Ministry of Health ekyasobola okutracinga bonna. Wetunaabulwa tracing obanga tracing line waliwo gye bayita network ng'olaba bangi nnyo kati awo ng'omanya tulina obuzibu.
Yes, but government seem to be lamenting about this disease just like the rest of us Ugandans. Government bwe nti abantu bakyajemye okugondera SOPs ku Ebola. Ekibuuzo kiddayo gye bali nti gwe gavumenti okoze ogugo gw'okubasomesa. Council, nze naawe tubaddewo twalaba wano gavumenti bwe yateekamu ennyo amaanyi mu kusomesa abantu ku Ebola. Polio. Then we're back. Nga campaign ziri literally everywhere. Mabasi, mu parka, mu taxis, everywhere. I've not seen that aggressive campaign and sensitization ku Ebola?
Kati ekisooka
People don't have the information.
Nze kanjogere bwenti ate si mu bubi. Ekisooka mulina okumanya nti government eina resources naye nga tezimala kola buli kintu ku mutindo gwe twandikyagaddeko. Ekyo reality era woba olaba embeera eriwo ojja kimanya. Ekyokubiri simanyi atamanyi mu ggwanga nti Ebola atta. Mubaddemu abatono abadde balowooza ddogo naye ndabye sensitization mu district says zibadde affected ziraga nti lino si ddogo ti ate kino kitta okusinga ne covid gwe mwali mumanyi. Naye ekikulu mu byonna obuvunaanyizibwa tuleme bulekera gavumenti yokka. Obuvunaanyizibwa tuli wano tusomesa ku Ebola. Obuvunaanyizibwa bwa buli muntu ssekinnoomu kasita oba ng'olina amagezi agategeera ekirwadde kino okwatibwako okutegeeza munno atakitegeera bulungi kuba emikisa gyawuka bw'osobola okitegeera naye nga neighbour takitegeera oba neighbour n'akitegeera mu community naye community eddako nga tekitegeera. So role ya sensitization tegwa mu ffe gavumenti. My government tugitunuulira bubi waggululira definition ya government. Government si Museveni, government si minister, ffe abantu, government of the people, by the people, for the people. You know, ffe government tulina okugezaako okutuukirira abo abatasobola kutuukibwako government. And kamaleyo point yange. Because when you talk about media campaigns and you look at the statistics, how many Ugandans watch TV? How many Ugandans listen to radio? How many Ugandans are on social media? So it's incumbent on us, we who have been blessed to have
to seek the information.
But
where do you get it? You see,
to pass it on. Information, by the way.
Council, I've just told you who polled you. Just poll you, and I think that's one of the best campaigns.
And I agree with you. I agree with you. Government can do better when it gets to sensitizing the masses. But while it struggles to do better, we also have a role as a citizen to sensitize others. We can't, you know, I am sorry, atesimubi. Tuve mutuluba lyokkaaba buli ssaawa o gavumenti etuyambe gavumenti erwa gavumenti tekoze kintu gwe nga ssekinnoomu okozeewo ki okutegeeza abo b'otamanyi. Nze ntambula ku kyalo era wembazanga bagamba mumanyi waliwo obulwadde ekyo mukola mumanyi kisobola obbalwaza. Sensitize the masses. Take personal initiative.
Ku individual level with the steps government has taken so far?
I think so far I'm satisfied with the steps government has taken.
When cases are increasing, because every day that goes by.
Now,
by September 28th, we had, you know, just 2 districts. Now we are talking 90 districts in a period of less than 2 months.
First, until the disease is eradicated, there will be cases. You can't say government.
Spreading all over.
You can't, yes, all over is where? 9 districts. All over, we have 145 districts. 9 are affected. And when you look at the 9, the situation should not be as alarming as it's being made. Because you have 17 cases in Kampala. The Kampala has over 8 million people staying in here. But of the 8 million, there are 17, and others have been traced. I think let's also appreciate the good that government has done. And I think government has taken good steps towards ensuring the curtailment of the spread of the disease. Can it do better? Can it do more? Yes, it can. Do better, it can do more. But have they taken steps? Yes. Am I happy with what they have done so far? Yes, because if they had not taken the steps they've taken so far, by now, I think the situation would be out of hand. But it's not out of hand. And Ugandans need to be comfortable in the knowledge that it is not out of hand. However, if we are not careful enough to take personal precaution, because government cannot be everywhere. Government is you. Good. You're the one that represents it. If we do not take personal precaution, it can easily get out of hand.
Is there any reason for Ugandans to worry about this?
Now, I don't think Ugandans have a reason to get worried. But I think Ugandans have a reason to be concerned. Those are two different things. The situation we are in is not worrying, but it arises a lot of concern. Because if we are not vigilant enough, this disease can turn into a pandemic. It can get out of control. So I don't think Ugandans should worry.
Okay.
It's not yet at the level of worrying proportions, but I think you need to be concerned. Yeah.
Council, lero tusubira omukulembeze wa Uganda, General Museveni, okwogerako eri eggwanga ku nsonga eno ku ssaawa 2 wano ku Baba TV. Do you think a nationwide lockdown is an option?
We haven't reached a level where we shall have a nationwide lockdown. So that will not happen. But we need to be careful not to get there. We haven't yet reached that level, but if we are not careful, we will move ourselves to that level. And that's why I'm saying all of us have to be concerned, but also equally vigilant in ensuring that this spread is curtailed. These weddings now we are doing, I mean, you need to reduce the numbers.
No, but government has allowed them to happen. You see,
yes, because of...
I saw nearly 50,000 people, no any measure that is being taken. Government will have until your risk, the risk is high.
Ate kyogambye government weerabanga risk eri high. Kati tennalaba nti risk eri ki eri high.
So it is okay for 5,000 people to congregate?
I think for now, it seems to be okay.
In Kampala, which you've just said that.
But please listen. Whether it is okay, whether it is legal or otherwise, my opinion to those that are listening to us is you are responsible for your own life. You are responsible. You will die, we shall bury you. You cannot put the responsibility on somebody else. Government has taken steps. This is the economy trying to recover. Yes, we have traceability, but what initiatives are you taking as an individual? We haven't yet reached the proportion of a lockdown. But if this thing gets out of hand, we shall lock down. It is an inevitability. So in the interim, as a responsible person, a person responsible for your own life, I think you need to take initiatives to protect yourself. And I think in today's address, the president needs to talk about the issue of large gatherings, because we can easily move from 17 to 500 plus.
17 what?
From 17, infected victims to more than that. So we need to reduce and eradicate. So
that means, Council, you are equally concerned.
Yes.
Large crowds.
I am. I am. Yes, I am. And every Ugandan should be concerned.
Because the risk here is, Council, nobody actually would wish Uganda mu lockdown in ate eyeggwanga lyonna. But woleka amabala ne gakubako nga bwe gavadde. Noleka concerts nga ze nalabye e Rugogo ewa Bizonto. Noleka concert eya Eddie Kenzo nga bwe yabadde e Kololo. Noleka amasinzizo, because I know churches that have more than 2,000 people buli lwa Sunday. The same applies to certain mosques. Ate n'ogamba banaga nti bannange mmwe you risk bwe munaakola bwe muti kitegeeza gwe embeera gy'otaddewo, you are making Ugandans actually vulnerable. But
Ugandans also are not idiots. Ugandans have brains. Ugandans know what to do. Ugandans have been guided. So you have to take all those circumstances into consideration. I know the church I go to still has social distancing rules, still has sanitizers and all those things. So when you still have traceability, even when you are concerned about large crowds, how do you ensure that these large crowds do not become a future issue? And I think that's what we should all be concerned about.
Yeah. Okay, tukuenza kanso tumalirize.
You fellow Ugandans, we are in a good place, but we are not in a perfect place. And we need to respect SOPs, but also some of these regulations set in place by government for our welfare. Ebola can be beaten. Ebola can be defeated. Ebola can be done away with, but the ability to do that without strain, pain, and rigor is dependent on our own personal discipline and initiative. Let's wash our hands, let's sanitize, let's avoid crowds where we can, but above all, let's get the sick to hospital so that they get attention. This is a treatable disease.
Waliwo nagambye nga tumaliriza nti council asobola okuteebereza kikyasubira omukulembeze okuwonako mu mbeera gye tulimu ya Ebola.
Ekisooka, I think the president agenda to a situation nga bweri otugumya n'okwongerako ku ebyo ebigenda okuddako. Naye ebiddako tetusuubirayo lockdown, tetunnatuuka ku kiseera ekyo, at least mu meetings ezimu entonotono zembaddemu tetujja kubeera ne lockdown. Tetusuubirayo curtailment, okuggala amasinzizo n'ebintu ebimu ng'ebyo tebijja kubaawo, naye caution egenda kuweebwa ate we tuta heeding a caution eyo. Tujja kuggala.
Tukoyenza nnyo oyo Council Simon Peter Kinobe yali mukulembeze wa bannamateeka mu ggwanga ava mu kibiina ekisinga obunene mu ggwanga era ekiri mu bukulembeze ekya NRM. Leero bwe tubadde akugambye nti obulwadde tebumanya kibiina, nolwekyo take the precautionary measures ku individual level nga bw'odimandinga gavumenti okubanga ekola ogwayo. You also play your part. Nze Adam Kungu, program ganga mukegenda kubakoma wano sa Simon Muyanga Lutaya, Doreen Mwesige bwe twakedde ffenna ku ssaawa 12 tukomye wanenca program yemu ombaka Luta Maguzi Semakula gwenyo okuba naye akuume jamu.